ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello and welcome. My name is Nicholas and I'm your host for today's ECDC On Air podcast, the podcast of the European Centre for Disease Prevention and Control, which is recorded from our headquarters in Stockholm, Sweden. In this episode, you will learn more about influenza, how much of a threat it is to people's health, if the COVID-19 pandemic is really comparable to a bad flu season, and what we can expect of the upcoming flu season. With me today, I have Pasi Penttinen, who's an infectious disease expert here at ECDC, with a specialization in influenza and respiratory diseases.
Well, thank you so much for having me. It's a pleasure to be here.
Can you maybe just start off by presenting yourself? What's your background? What do you do here at ECDC?
I'm a medical epidemiologist trained in Finland. I started off my career with actually environmental epidemiology, working on the health effects of respiratory particles in ambient air. And pretty soon after that, I moved into infectious disease epidemiology, communicable disease control, through a program which is actually currently housed by ECDC. At the time, ECDC didn't exist, but the program was there, the so-called EPIET program, which is a European program for intervention epidemiology training. And that really got me hooked into this world of communicable disease control and infectious disease epidemiology. I spent in between a little bit of time in Indonesia, but otherwise I've been working in the Finnish Public Health Agency, the Swedish Public Health Agency, and now since 2009 at ECDC. Here at ECDC, I currently work as a principal expert on coronaviruses and influenza. And I have been working also on epidemic intelligence and crisis response and these kind of topics in the previous parts of my work here.
Okay, so I imagine you must have been very busy also here with the COVID-19 response.
Yes, indeed. Since January of 2020, I've been pretty much full-time involved with the coronavirus response in various kinds of roles. As you know, a big part of our organization has been sort of providing the European-wide support on this topic.
Can you explain to us what does ECDC do in terms of flu prevention and control in Europe?
What we do in terms of flu prevention control is very much a snapshot of what we do on other diseases also in ECDC. Really, the core activity of ECDC is, first of all, the surveillance of communicable diseases in Europe. So we run the surveillance system, we call it the TESI, the European Surveillance System for Infectious Diseases, where the National Public Health Institutes report the number of cases they are detecting in their territories, and we collect the data, analyze the data, and report back. And for flu, we do that on a weekly basis during the influenza season. A very important role for us is also this kind of early warning function. So we have an epidemic intelligence team that is picking up any unusual signals for communicable diseases, outbreaks or unusual events with the vaccine, for example, and thus forth. And this is for influenza has been particularly important for the avian influenza outbreaks that have been occurring over the past 10, 15 years. And it's actually been one of the most reported outbreaks in ECDC's monitoring of infectious disease outbreaks. We provide some monitoring of the vaccination programs in the countries also for influenza. We run currently, and this is ECDC in general, not our program in particular, but we run a collaboration of the national immunization technical advisory groups where countries share the evidence base they are using for their vaccination programs. And given that the influenza vaccination program is slightly different from most of the other vaccination programs, which are targeting children by and large, there is quite a lot of work on this area. There's a number of different influenza vaccines, and there's a lot of differences in their effectiveness that need to be monitored and discussed in this format. So we provide a platform for scientific advice, and we provide sometimes our own scientific advice on these topics that countries can use for their decision making. And of course, during the vaccination campaigns and the influenza season, kind of public communication is an important part of our work also. These are just some examples of what we cover.
Could you explain to our listeners a little bit more about there's different types of influenza? There's several different types. Can you explain what they are and how they are different and how they affect people differently?
Sure. So right now where we are is that we have 4 different types of influenza, A, B, C, and D. Now, based on the genetic composition, the ability of these viruses to infect cells and humans and cause severe disease is different. So for influenza B viruses, we know that they tend to cause more disease in the younger age groups, and the disease they cause in the adults and the elderly, although still important, is not as difficult as the influenza A viruses tend to cause. And the viruses that in the last years have been causing most problems for healthcare systems and European populations are the influenza A H3N2 viruses, so the hemagglutinin 3 neuraminidase 2 viruses. And these viruses, for reasons which we don't fully understand yet, tend to cause much more severe disease in the elderly populations who are already fragile and have multiple underlying conditions. So the mortality impact and the impact on the healthcare system on a season when you have a AH3N2 virus circulating can be very, very significant.
That's really interesting. So, but can you explain a little bit more then about how many people are dying each year of flu in Europe? As I understand it, sometimes we tend to kind of underestimate actually the impact of flu. Is that correct?
It's true. I think if you talk to the person on the street, for most people, they don't perceive influenza as a very severe disease. And normally we would say that we're in the range of tens of thousands of deaths in the population of 500 million Europeans every season. But in a severe season, we have shown after the 2009 influenza pandemic that we can go up to over 100,000, even over 200,000 deaths during a season. So this disease can have a significant population level impact. And I think that's what's really underestimated in not only with healthcare providers, but also in the general population.
Last year, though, it was a bit of a special year. Obviously, the whole world experienced the pandemic and there was hardly any flu circulating at all. Can you explain a little bit why the reasons for that were?
I can speculate. I don't think I can explain. This was really an unusual event. Nobody expected it. So the whole world scientific community kind of came afterhand to see that this was the impact. But now, after the events, I think it's easy enough to speculate that these non-pharmaceutical interventions that we put in place to decrease the transmission of COVID-19, so we're talking about use of face mask in the community, we're talking about the implementation of physical distancing measures, teleworking and tele-education for schools. We're talking about improvements in ventilation policies. We're talking about cancellation of mass gatherings for large parts of the year. Also, the reduction of travel across national borders and within national borders. Now, all of these measures were actually originally sort of described and designed for influenza pandemics. And there is this fact that the SARS-CoV-2 virus or the COVID disease transmits much more effectively than the influenza virus does, but it transmits in very similar ways than influenza virus does. So when you put in measures at such a draconian scale that it's affecting the COVID-19 transmission, which needs a lot of effort, you will inevitably have the influence on influenza virus also. And we'll need to see the studies coming through, need to see the long-term sort of outcome of this. But this is most likely the reason why influenza completely disappeared out of the world. It was really impressive. There were many countries that were looking at the situation and really doing testing in their hospitalized populations of respiratory disease, and they couldn't find any influenza. There was a few sort of small spots in Cambodia, northern Africa, where you could see some influenza transmission, but almost none, both in the southern and the northern hemisphere. Very unusual situation.
That's interesting. I just wanted to go back to what you said about the effectiveness of social distancing measures and how that has an impact. If you would recommend, or if you would give some recommendations to somebody how best to protect yourself from flu, would that include what you mentioned there about the physical distancing, the non-pharmaceutical measures like hand washing and so on? Or what is the most effective way to protect yourself?
Well, I think that's likely to be one of the most important lessons learned out of the COVID-19 pandemic for the influenza work. We already had discussions before the COVID-19 pandemic on the effectiveness of these non-pharmaceutical interventions on the transmission of influenza. This was mainly in the context of pandemic influenza. But given that we had few very, very difficult seasons of influenza A, H3 and 2 in the years running up to COVID-19, the question was brought up in these scientific and public health tables whether or not we should be more forcefully suggesting the use of various kind of non-pharmaceutical interventions for seasonal influenza when they appear, especially when we know that it's going to have a severe impact. And I do think that we will be moving more into that direction in the coming influenza seasons, as we now have very clear evidence that it's still speculative, I must say so, but it's probable that once we look at the evidence, we will come to the conclusion that the NPIs, the non-pharmaceutical interventions, they did work against influenza by themselves. So why not use this for a disease which is causing so big impact at the population level? I don't think there is political will or it is acceptable to the populations at large to go to these wide-scale measures that we did for COVID-19. I mean, COVID-19 is a much more severe disease, so you have to take that into account. Thinking in a bit more sort of a refined manner of these things, if you have an elderly relative who has multiple chronic conditions who will be vaccinated for influenza, but who we know that will mount a suboptimal response to influenza vaccines because of their age, why not, when we know that influenza starts circulating in the city or around you, why should we not take these protective measures to protect that person? I mean, is the use of face masks such a big hinder to our daily lives that we couldn't use it for a few weeks once the influenza season is at top? Can we not, and in many countries that's already recommended, make sure that when the influenza season is ongoing that you are making sure that the small children who are a big source of transmission for influenza are not meeting their grandparents during those weeks, and we save it for the later in the year. One can do these things at a more sort of refined way and a more prescribed way than we did for the pandemic. And I think definitely we, as public health agencies, we should be looking at what exactly is the message around this, as you can save lives with these measures and it's doable. Just as a backdrop to this, in many Asian countries, during the respiratory season, it is common practice, it's the norm that one wears masks in the community. I have not been able to uncover any evidence that they show that this is effective, but it is kind of accepted whether or not you have symptoms yourself, that you wear a mask to protect others. It's not so much to protect yourself.
You mentioned a little bit earlier about avian flu and that ECDC is also involved in monitoring those outbreaks. Could you explain a bit more, why is flu in birds a problem?
We don't know for sure, but it's quite likely that most of these influenza A viruses at some point in time have emerged from animal populations. Influenza B viruses, we don't know of animals that harbor them, so they are most likely only in human populations, therefore having a slightly different picture also in terms of the disease. But a lot of the influenza A viruses probably have what we call a zoonotic origin, so they are a jump between animal species and humans. And influenza A H5 viruses are kind of the prototype of avian influenza viruses, which were first detected in the early 2000s, late 90s, as an important influenza virus which can jump from birds to humans. Given that we have an influenza A virus which has been only described in animals like birds, it means that the human population does not have any immunity normally against these viruses. So if animal virus jumps to a human and gains the ability to transmit between humans like the seasonal influenza viruses do, this would be the kind of initiation of an influenza pandemic. So by detecting the very first cases of human spillover events of avian influenza viruses, this is one of the earliest time points where you can kind of prepare yourself for potential pandemic evolution. So therefore, it's very important to pick up very early individual cases or outbreaks that may be linked to birds, which are the most common sort of zoonotic source at this stage, but also in swines, which harbor a lot of influenza viruses and cause human cases every year in some parts of the world.
I know that ECDC has been doing some studies on the coverage around Europe for priority groups for seasonal influenza vaccination, and the results have been, I would say, a bit suboptimal. Can you talk a little bit more about that and explain why is that?
At the EU level, back in 2009, the governments agreed together that influenza vaccination should be made a priority in the countries, targeting what we call the risk groups. So this is the elderly populations, people with underlying medical conditions, and also healthcare workers who are more exposed to the virus, but also can then infect those two previous groups in their everyday work. On top of that, some countries in Europe have started vaccination programs for children, mainly with the purpose of reducing the transmission of the virus in the communities, not so much to affect the severe outcomes of the children themselves, as there's not that many. It's only in the very, very young groups. Now, the target that the government set in 2009 was 75% of these target groups vaccinated. And unfortunately, in our last review back in 2018, there were very few countries in Europe at the time who had achieved that target, despite 10 years of active campaigns and work on this front. It's a very difficult question why we haven't been able to achieve more. I think it's firstly very much related to what we discussed earlier, that the perception of influenza as a severe disease is not that high in the general population. This is very important to keep in mind. Also, even in the sort of professional spheres, in some countries, it is thought that influenza, compared to the many other health issues that countries and governments are dealing with, is not high enough on the priority agenda to have sufficient funding available for those programs, the administration and the purchase of these vaccines. But there is a third reason also, and that is the fact that unfortunately, and that's partially linked to the way that we produce most of the vaccines and partially linked to the fact that this annual drifts of the virus is happening, the influenza vaccine is not 100% effective, and in fact is in many seasons not effective in a way that we can say that the effectiveness is good. So it really varies from year to year, and this of course is not a very positive thing for the programs either. Now, we are very lucky that they're very, very safe vaccines, so we don't see adverse events coming out of it. But of course, if you are a young adult and you may have some pre-existing condition, you don't perceive the illness to be that severe for yourself, and you know that the vaccine is a bit suboptimal, it's hard to find the time and the effort to go and get vaccinated. I mean, we all know it from our own work, even though we know all of the data and the information below, but you still need to actually do an active effort to get that vaccination on a seasonal basis. And with all the daily pressures, it's sometimes difficult.
I'm wondering also if maybe vaccine hesitancy could be a factor here. I mean, we see obviously here with the COVID-19 vaccine that there is certain hesitancy in terms of the uptake of the COVID-19 vaccine. We've seen that with the measles vaccine as well. Do you think that it's the same with the flu vaccine?
Absolutely. And I think it's really sort of even heightened for the flu vaccines because of the reasons that I just mentioned. So there is not such a big drive for the vaccines themselves in terms of, the immediate protection for the individual themselves, unless they are really in the elderly age groups and with multiple comorbidities. But it is an interesting phenomena of the modern world that we live in Europe today. I mean, much of the progress in our health over the last 100 years can be attributed to vaccines. All of us in working life today have benefited multitudes from the protection of these childhood vaccine programs, which are routine in Europe today. We eradicated smallpox. Nobody needs to think about the threat, which was causing millions of deaths around the world when it was circulating. So we take these things for granted. And once we don't see the visible sort of outcomes of diseases, it's much easier to be hesitant about these kind of protective measures. And I think that's a pity. There's a lot of work for public health authorities, but also for healthcare workers to keep that message in mind. This is causing major issues for vaccination programs, influenza and others. There's also what I think is very unfortunate, but one must keep in mind that there is kind of a lot of misinformation being circulated and a lot of disinformation, so intentional false information being circulated today, where we are moving into an information environment where individuals are getting a lot of information through kind of peer-to-peer methods, so from social media, from individuals, rather than from organized media where it has been somehow screened in between. So it creates also financial opportunities for actors in that sphere to get followers, get clicks on their advertisements and so forth, when they spread information which is outrageous and not in line with kind of accepted scientific truth. Very dangerous in my mind.
As you mentioned earlier, there is quite a significant number of deaths each year. I'm thinking back to the beginnings of the COVID-19 pandemic when people were trying to figure out how severe this virus is. And you heard several voices, several leaders, politicians saying that, don't worry, this is just like a normal flu season. Could you maybe give your comments on those kind of statements?
In the beginning of any epidemic, and as you know, in the first weeks of this situation, the first months of this situation, we were very much dependent for kind of population level statistics on the information coming out of China. There are two aspects to this. First of all, there tends to be a hesitancy to accept at face value information coming from areas very far from your own and with very different kind of cultural and economic sort of settings. But there's also kind of dynamic that early on in the epidemics, one is only catching in the surveillance system only the severe cases. So it's for us who are watching these kind of situations, we tend to be very careful in the beginning of these situations with our severity estimates, because oftentimes as time goes by, these severity estimates are diluted so that you see that it's in the end, it's not quite as severe a disease as it was in the beginning. However, at least by the time that we started to see significant numbers of cases in Italy and we started to have sort of data points from a few different places, it was starting to be clear that this was a relatively severe disease and definitely more severe than a regular seasonal influenza. At that time, there were many sort of attempts to quantify this. And the other extreme, of course, was the 1918 influenza pandemic, which is kind of the most severe pandemic that we have documented in a proper way globally. And the other extreme was then normal influenza season. So we ended up in a situation where we are roughly speaking kind of looking at a disease which is 10 times more severe than seasonal influenza. We still have some public voices who are comparing the two, but I really have difficulties in this message because we are really talking about a much different virus with coronavirus than we are with influenza. The other side of the coin here is where are we going now with COVID-19? And we hear a lot that this is a situation which we will need to live with. And there will be a kind of level of acceptability in terms of the impact of COVID-19 going forward that the society as a whole needs to live with and accept. And the comparison often made is that if at the population level the impact is similar to influenza, that is something we have accepted in the past. So probably that is a level that we are going to have to accept for COVID-19. I personally question that. I mean, as said, we have every year tens of thousands of people dying of influenza. On the worst years, we have more than 200,000 people in Europe only dying of influenza. Is this something that we really accept as a society? I have difficulty accepting that myself.
Indeed, it sounds like a very high figure, and to just accept to let go of that figure would be questionable. Also, given the fact that it can be prevented. This leads me on a little bit to the next question. We found that, as we were speaking about before, that there was very little flu last year. I wanted to have you explain a bit more what impact this would have on the upcoming flu season, because as I understand it, if you have a flu season which is very mild, there may be a risk of future flu seasons to be more severe because people lack the immunity that they would have gotten otherwise. Is that correct? And what implications does this then have now for the upcoming flu season?
The fact that most EU countries are now lifting their non-pharmaceutical interventions for COVID-19 as the vaccination programs for COVID-19 are moving well forward means that the opportunity for the virus to jump from person to person increase, and probably there will be even sort of more socializing happening in the coming weeks than there were during the last 20 months. So there is a real possibility of a proper influenza season happening this winter. Now, it's still because of this situation of no circulation for the last 20 months, it's a very unusual situation. So it's very difficult for anyone. I mean, it's always difficult to make predictions for influenza, but especially in this situation, I think it's fair to say that nobody knows what will happen in the upcoming winter. But let's say that there is a real opportunity for we know that the virus that is circulating now is the one that causes severe outcomes in the elderly. From other infectious diseases, we know that this situation where you have no circulation of the virus in the population causes, and you don't have a vaccination program which covers the whole population, causes the fact that you have a larger pool of what we call susceptible individuals, so people who have not been exposed to the virus or the vaccine, and which means that you have this, let's say, a playing ground for the virus to jump around in and cause more disease there. So there is a real possibility that the season upcoming is not only severe with the clinical picture for the individuals, but also the number of people it's infecting in Europe. So I think we need to be really vigilant for the upcoming 3-4 months as we go into winter.
So given this big uncertainty, as you explained, what would be your message for people for the upcoming flu season? What precautions do people need to take?
So they're pretty much what we've already covered here. I mean, the most important thing is for the vulnerable population groups, so the elderly, people with chronic medical risk factors in the background. So we're talking about people with cardiovascular disease, with respiratory disease, with some kind of organ malfunctions, with diabetes being an important group. So these people, to get vaccinated, protect themselves, they are covered in most programs in European Union member states. I'd say the healthcare workers should be the absolute top priority. In my view, everybody who steps foot in a healthcare service or a nursing home between October and February of a year should be influenza vaccinated, whether it's the individuals, the staff members, or the friends and family of these individuals in these facilities. So that's another thing, that if you have the possibility and you have sort of close family members or friends that are frail, elderly, have serious illnesses, one of the best things you can do to protect them is to get vaccinated yourself. Now, this is not covered in most countries' influenza vaccination programs, but you can also do that in a private manner in many settings. And the other part, as I mentioned, is that when we start to see influenza circulation in the population, we can use these social distancing measures that we are now so familiar with. We can use the masks to give some additional protection. Again, they are not going to be 100% protection, but they will decrease the chances of you getting ill or you transmitting the disease to somebody that may get a very severe outcome of the disease.
Okay, thanks a lot, Pasi. That was a really interesting discussion here. So I'd like to thank you for coming on air with us, and hope to hear more from you on other topics in the future.
Thank you for having me.
We hope you found this episode on influenza informative. For more information on the COVID-19 pandemic or more information about ECDC in general, please visit us at ecdc.europa.eu or follow us on social media for the latest news.